The meteoric rise in autism is among the most alarming public health developments in history. Since 2000, autism rates have surged by much more than 400%. You know, there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. Is that a correct statement, by the way?
Yeah, with the Amish, for example.
The Amish, yeah. Virtually, I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. First, effective immediately, the FDA will be notifying physicians that the use of acetaminophen, which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. The other thing that I can tell you that I'll say that they will maybe say at a little bit later date, but I think when you go for the shot, you do it over a 5-time period. And they pump so much stuff into those beautiful little babies, it's a disgrace.
To meet the president's challenge, I ordered HHS to launch an unprecedented all-agency effort to identify all causes of autism, including toxic and pharmaceutical exposures. NIH research teams are currently testing multiple hypotheses with no area off limits. We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress. Some 40 to 70% of mothers who have children with autism believe that their child was injured by a vaccine. President Trump believes that we should be listening to these mothers instead of gaslighting and marginalizing them like prior administrations.